Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Researchers uncover key missing link in understanding autoimmune disorders. Autoimmune disease, which are estimated to affect more than 15 million people in the US, occur when the body responds to immune system false alarms and infection-fighting first responders are sent out to attack threats that aren't there. Now, scientists at Washington University School of Medicine in St. Louis and the Perelman School of Medicine at the University of Pennsylvania have identified a key component to launching immune activity and overactivity. The researchers identified a protein in cells that spurs the release of infection-fighting molecules. The protein, whose role in the immune system had not been previously been suspected, provides a potential target for therapies that could prevent overactive immune responses that are the root of several debilitating illnesses. Their paper appeared online in Cell. The team of researchers made the discovery by studying a rare autoimmune disease called STING associated vasculopathy with onset in infancy. The condition is extremely rare, occurring in 1 of every 1 million births. It leads to immune response attacking tissues in the lungs and limbs of patients, often resulting in death before adulthood. Caregivers of adult cancer patients face elevated traumatic stress levels, study reveals. Every year, millions of family members and friends provide care for loved ones undergoing cancer treatment, often at great emotional cost. A new scoping review published this week in Archives of Geriatrics and Gerontology Plus confirms the toll that this work can take on caregivers' mental health. According to the review, most studies shows that more than 15% of those who care for loved ones with cancer suffer from post-traumatic stress disorder. The comprehensive literature review found that caregivers with pre-existing mental health conditions, lower social support and higher caregiver burden were at greater risk of post-traumatic stress disorder. Additionally, patient-related factors such as disease severity, symptom burden, and perceived likelihood of death also contributed to caregiver distress. The study also found that caregivers of patients with head and neck cancer or acute leukemia were among the most distressed, with up to 37% of them meeting post-traumatic stress disorder criteria. Ultrafine bubble showers offer relief for atopic dermatitis, study finds. Bubble baths might be soothing soaks, but bubble showers could be the next thing in keeping the skin clean. An Osaka Metropolitan University-led medical research team found that ultrafine bubble showers might help prevent atopic dermatitis. Atopic dermatitis is a common and relapsing skin disease characterized by skin barrier dysfunction, inflammation, and chronic pruritus. Both cutaneous barrier dysfunction and immune dysregulation are critical etiologies of the pathology of AD. Although various anti-inflammatory pharmacological agents including cytokine inhibitors and signaling pathway blockers have been developed recently, keeping the skin clean is of utmost importance in maintaining psychological cutaneous barrier function and avoiding an atopic dermatitis flare. Ultrafine bubbles are less than 1 micrometer in diameter and usually used to clean medical equipment. An ultrafine bubble shower is expected to keep skin clean with attention to temperature and strength of the shower. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.